Today I'm with my patient Larry. About 4 months ago, he and his wife came in to learn about the Lampee Rejuvenation. It'd been a long time since he had been to the dentist. How many years had it been, Larry?
Well, I'm like any male, afraid of the dentist, afraid of the pain.
Yeah.
So I avoided it quite a bit. My wife did the research to find you and said, this is the dentist I should be talking to.
Very good. Okay. You've obviously got a good woman in your life.
Yes, I do.
How many years since you last went to the dentist?
I had some cancer that required some radiation in my face.
Head and neck area?
Yes.
Okay.
Which damaged my gums.
Oh, yeah.
So what's happened was expected.
Okay.
But I just didn't come to a dentist quick enough to take care.
I have a lot of patients after cancer treatments where I have to do extractions and implants because of what happens during the cancer. The cancer treatments obviously are saving your life, but a lot of times it can do very, very irreparable damage to the teeth and the oral tissues, basically.
Exactly what took place with me.
Yeah, yeah, and that's part of why you needed this work. You know, you've been dealing, for so many years with all the cancer treatments and all that obviously those were first and foremost. And once you, in remission, had beaten cancer, what, 4 times?
4 times.
Now it was time to deal with your teeth, basically.
Right.
I have a lot of patients, they haven't been in 5, 10, 20 years because either they're raising their kids or they're too busy with their careers or really they just don't want to deal with what's going on in their mouth. And so your wife did the research. Why did she kind of want you to get some stuff done? Had she been kind of talking to you about it or pushing you for a little while on that, or
She's been pushing me for over a year.
Okay.
And again, like I said, I was hesitant. But I gotta say, when I met you and you sat me down and did your exam and told me what I needed to be done, everything you told me I needed to have done, and you did, was a miracle. Very, very little pain, which is, of course, what I had the most fear of. And then you said that I wouldn't have much. It was totally a fascinating experience, and already, just after all this has been done, all my friends are saying, God, it's good to see you smiling.
They noticed almost like an immediate difference that...
Absolutely.
Wow, okay, okay. And so you came in, we did our exam, we did our x-rays, we did photographs as well. The x-rays helped me figure out how much infection is in the mouth, and there was a lot. There was infection in your top teeth, your lower teeth, and I think you were missing some teeth from a car accident too. That was many years ago. A long time ago. And so we're dealing with, missing teeth from a car accident. We're dealing with your mouth after cancer treatments. And there were, what, 2 or 3 bouts with cancer in the last 20 years?
4 bouts.
4, okay. So you are a miracle, too.
My doctor's a surprise.
Okay. Okay. So we looked at all that, and I remember when we looked at the photos that I don't think you'd really seen up-close photos of what your mouth looked like on the inside.
No.
And it can be kind of scary sometimes because usually we just see the very front teeth. And if the very front teeth look all right, sometimes we kind of ignore what's way in the back. But most of the infection was in the back, on the top and bottom. And so we talked about the different ways of getting this done, basically. And we basically decided that there weren't very many good teeth in your mouth left, so we needed to basically take them out, kind of start with a blank canvas.
Yes.
And in the course of one day, we basically, we worked with an anesthesiologist that day, and that made it so much easier, less stressful, and we took all the teeth out, and we put in 8 implants that day, 4 on the lower, 4 on the top, and then we gave you new teeth that day. So you had basically your new smile that day, but we don't like to connect teeth to the implants for about 4 months because we need good bone to grow around the implants, we need good gum tissue to grow around the implants, we need everything to basically fuse together, and it takes a little bit of time for that. And I do think it took just shy of 4 months to finish it, from the day of surgery to the healing to the uncovering of the implants. and then to the final connection day, which was what, a week or two ago, where basically we did our impressions that day, did our final connectors, and so now we're 4 months from the day we started, done. Your gums look amazing, your implants look amazing, the teeth, obviously, your friends are saying you can smile again, and I mean, I've seen the change in you where when you first came in, your wife's bringing you in, and you're a little quieter, and you're like, what is this all about, and is this going to be real? Is this going to really happen in 4 months? And now you're full of life.
That's right.
Oh.
I'm enjoying the food again. Even my speech is better now, because with the dentures that we needed still initially,
yeah,
I just couldn't imagine how this was going to feel good. I was glad to have the disease out of my mouth.
Yes.
But I didn't think that the final, when we had it installed, I would have the freedom I have to eat now. And it's incredible. I'll probably put on another 50 pounds right away.
That's good. That's
I'll be eating steak again.
You had steak last night, I think.
I did.
Yeah.
It's been a miracle. If anyone has ever asked me about the experience I had, I said, go to Dr. Lampee. He'll change your life.
No, that makes me feel good because I've been out of school for over 10 years now, and I didn't know about any of this. They don't teach any of this in schools. They don't even teach about this sort of transformational stuff in the educational classes that I do. This is something that just kind of naturally started to happen, where I had some patients come in who they weren't feeling well or their teeth weren't in good shape, and other dentists had been trying to save them, and they're like, maybe I just want my teeth out. And it was through the first few of those that I realized that the power that if we can really see what our patients need long-term for the rest of their lives, get infection out of their mouths, get them smiling again, get them eating again, I found that they become really new people. And I mean, I'm seeing that I mean, you obviously have a zest for life, and it's really just, I've seen it come out even more in the last 4 months, and that's what makes me feel good about what I do. Because a lot of dentistry is people are scared. They think you're gonna hurt them, and it can be a very, very difficult job for most practitioners, and it can be very thankless. And so this is how it makes it so exciting that I get to do this, and it makes me feel good to be part of it, and that we improve lives. And I mean, it makes me feel very, very good that you feel so good about it, and we've done everything that we set out to do in the course of 4 months. It's amazing. I mean, it really is.
Well, like any business, to be successful in it, it's important that you know your talent, the technique, which you're obviously an expert at, but it's also important to have a good staff. And your staff amazed me. I felt good every time I come in here.
I cannot do this alone. Yeah. The team members I have around me, from the team members that are here every day that you see at the front office helping us in the back, to the anesthesiologists we work with, to dental laboratory we work with to make all of this possible. This is a high-functioning sports team in a way. Wow. To make it happen.
I enjoy walking in and be greeted with a smile.
Yeah. A lot of my patients, it is their wife or spouse that brings them in or encourages them to come in. 4 months ago, you and your wife came in, we talked, we met, we decided to work together. 4 months later, we are done. How does she feel about everything and kind of the new Larry?
Well, she's absolutely elated with the new appearance. She's happy it's over, that we've gotten to this point.
Yeah.
And she's bragging now about, hey, I knew what I was doing when I suggested this, and she's pleased that she picked the right dentist to do it. Well, I've never been unconfident in life, but this definitely emboldens me more. I'll be able to go off to our new home in Arizona and be very comfortable meeting people. Not that I never was uncomfortable, but I'll be much more comfortable now talking with and meeting with people. You freed up a lot of my anxieties through this.
So getting everything healthy again, being able to really smile again, and not that you weren't confident to begin with, but now it's like, I got this.
Yeah, very well put.
Yeah.
I don't think I can come up with the proper superlatives to express how good this a hamburger is again. Steak. It's just anything now that I eat that I couldn't eat before is far more enjoyable and quite exciting, actually.
I've got patients that I do the implant denture procedure on in their 80s and 90s. And I see, you know, from working with them that it gives them that new lease on life. You know, it's something to look forward to. It's something that inherently we want to have teeth we can eat with, teeth that don't cause us pain, teeth that aren't infected. We want to have a nice smile because a lot of times that is what a lot of people see when they meet us, they talk to us.
Right.
And it feels very, very cool that even somebody at 85 or 90 or 70 or 60, it does the same thing. I mean, it makes them a new person.
I'm in awe.
Yeah.
I mean, it's just like I have regular teeth again.
Yeah. That aren't infected.
Yeah.
Your body doesn't have to fight the rest of the infection. So if your body doesn't have to fight the infection, it can do what it's supposed to do on a normal daily basis, which means healthy. I can't even tell you how appreciative I am that you would just be willing after 4 months to do this, to share your story and show it so that other people can see that this is real, this is possible, and that it can be very, very good and very, very transforming. So thank you so much.
Thank you, and I hope it encourages others like me to come forward and go through this treatment.